Welcome back to the Haircafe cinematic universe, hair loss witchers. Remember, a finasteride a day keeps the hair transplant doctor away. So let me tell y'all something, my fellow hair loss witchers. I'm always excited to release new content on my channel because I love providing my viewers with the heuristics that defeat the slaphead curse. Every now and then, though, I am unfortunately forced to backtrack a bit and revisit subjects that do not need to or deserve to be revisited. One of these subjects is post-finasteride syndrome. Obviously, this is a point of interest for many people, but I have already gone over all the existing research and presented the scientific consensus on this subject. And the scientific consensus is that this condition does not exist. I'm not saying this to be mean or troll the PFS community, that's just the reality of the situation here. Has there been any new research since my last post-finasteride syndrome video that has challenged this scientific consensus? No, there hasn't been. And unfortunately, thanks to the power of social media, there doesn't need to be. All it takes is one influential voice to raise concerns about this condition to make the entire internet panic, and that is precisely what has happened here thanks to our good friend Dr. Andrew Huberman, who has for some reason decided to start fear-mongering about finasteride. I'd like to say this is the first time I've had to call out Dr. Huberman for his bullshit, but it isn't. About 6 months ago, he did another video where he addressed the subject of hair loss. In the video, he made a bunch of amateurish, pseudoscientific, and downright false claims, such as claiming that minoxidil raises prolactin levels, or that topical caffeine is equal to minoxidil in terms of efficacy, or that you can regrow your hair by massaging your scalp to improve blood flow. Literally everything he said in the video was complete bullshit. But fortunately, I already did a response video to that, so I don't need to revisit that subject here today. I'll just link that video below. Today, though, Dr. Huberman, he takes a different approach to spreading hair loss misinformation, this time by gaslighting finasteride and dutasteride, which are clinically proven to be the most effective and safe hair loss treatments on the market today. He does this by fear-mongering about post-finasteride syndrome, and as I said, he doesn't present any kind of new research or data that hasn't already been critically analyzed and debunked. In fact, he doesn't present any data at all. Instead, he just invites a urologist onto his show, similar to what Dr. Attia recently did, and then he tries to get this urologist to admit that post-finasteride syndrome is a real thing and that finasteride is far too dangerous of a drug to consider for a measly cosmetic condition like hair loss. The urologist that Dr. Attia invited onto his show, he was a complete contrarian quack who takes medical positions completely outside of the mainstream within his practice, and I'll link that video below if you want to know what I'm talking about. The urologist in this video, though, Dr. Michael Eisenberg, is not a quack, and his views are more typical of what a professional in his type of practice would actually believe. So, it's funny how responding to both Dr. Huberman and Dr. Attia has become somewhat of a trend on my channel. Lots of people also request that I respond to Dr. Attia's interview with Derek from More Plates, More Dates, but most of what I heard and saw in that interview was pretty agreeable, and props to Derek for giving a more pro-finasteride narrative after Dr. Attia's previous guests spread so much misinformation about it. Anyways, this new video from Dr. Huberman is over 2.5 hours long, which gave me a heart attack initially because it would probably take about a month or longer to respond to it, but fortunately, the segment about post-finasteride syndrome specifically is only about 7 minutes long. Despite that, if you were to take a look at most of the comments on the video, almost all of them are from people talking about post-finasteride syndrome, so this 7-minute segment is obviously the only thing in the video most people cared about or even actually watched. So, just like in my last video, I know some Dr. Huberman fanboys are going to write comments like, "Oh yeah, Kevin, well Dr. Huberman is a neuroscientist, while you are just some dorky random YouTuber who has this strange obsession with The Witcher and cyberpunk. You clearly lack the qualifications to challenge the scientific integrity of Dr. Huberman, so haha." Well, a couple of things about that. First of all, being a neuroscientist does not get you off the hook for spreading bullshit. If Neil deGrasse Tyson were to start claiming that the theory of relativity is bunk, I wouldn't just say, "Oh, well, since you're an astrophysicist, I'll just go ahead and take your word for it." That is because appealing to authority is a logical fallacy, and the shit Dr. Huberman is spewing here doesn't magically become true just by the virtue of it coming from his mouth. In this video, Dr. Huberman is not only not using any scientific evidence to back up his claims, he's flat out concern trolling. What I mean by that is that he's asking questions in bad faith. He wants to appear to be concerned about hair loss sufferers by saying things that hair loss sufferers are being forced to choose between their hair and their sexual health, which of course is a completely false dichotomy. Finasteride users do not have to choose between their health and their hair because finasteride is a safe drug. But as we'll soon see, Dr. Huberman, under the guise of just asking questions, is determined to give a negative impression about finasteride. But he doesn't actually give any evidence for his concerns about finasteride. Instead, he just uses innuendo to make his case like certain politicians do, who are always using phrases like, "a lot of people are saying it's true," or "sources say." It's ironic that Dr. Huberman feels so strongly about this particular subject, since using finasteride is a choice that Dr. Huberman doesn't have to make in his lifetime, given that he obviously doesn't have to worry about androgenic alopecia. So it's easy for someone like him to dismiss hair loss as a trivial cosmetic condition, but he's completely wrong. There is objective data that proves that hair loss severely reduces the quality of one's life, and it can even shorten your lifespan. And I have a couple videos about that which I'll link below. I just wanted to bring that up though, because it is extremely frustrating to me, as I imagine it's frustrating to other hair loss sufferers, when people who don't have to deal with hair loss act like finasteride isn't worth it. If you haven't had to deal with hair loss, don't tell us our hair isn't worth saving. I have to admit though, it takes a lot of talent to cram so much misinformation within just a 7-minute video segment, but Andrew Huberman, he manages to achieve just that. So we've obviously got a lot of work to do, hair loss switchers, so let's go ahead and drink our potions and oil our blades with snake oil venom, and let us help enlighten Dr. Huberman to his follies.
As long as we're talking about DHT, dihydrotestosterone, it's only fair to discuss the drugs that many people take to suppress dihydrotestosterone in hopes to keep or grow their hair. Things like finasteride, dutasteride. Some, maybe many, not all, people who take these drugs, particularly in oral form, experience sexual dysfunction issues.
No, Dr. Huberman, there is no maybe many here. You don't get to just make up statistics like that. He says this as if the incidence of sexual side effects is anybody's guess, but that simply isn't true. We have objective data which shows that the likelihood of developing side effects on finasteride is rare, only about 2% higher than placebo when looking at the initial studies using finasteride for hair loss. The incidence of side effects from finasteride is not high, and the incidence is in line with most FDA-approved drugs on the market. Furthermore, we also have data that shows that even if you do get side effects from finasteride, the side effects will usually go away on their own shortly after starting the drug as your body adapts to it, and they will always go away upon cessation of the drug. So usually these side effects are very manageable. I'll link my videos below where I discuss that. I know it may sound like I'm making a mountain out of a molehill, but just imagine if I said something like, yeah, statins work to lower cholesterol, but they also kill some and maybe most people, but I'm not really sure, who knows. This is a misleading statement, but this is the tactic that Dr. Huberman uses throughout this video, as we'll see.
That said, my understanding is that these drugs are also quite useful, maybe even life-saving in some cases, for staving off certain forms of prostate cancer.
So what he's saying here about prostate cancer may be interpreted as a positive and reasonable statement, but as we'll see, he's saying this to set up a contrast between using finasteride for a serious condition like prostate cancer versus using it for a cosmetic condition like hair loss. He doesn't explicitly say it at this very moment in this video, but what he's basically trying to establish is the narrative that finasteride is a drug that should only be considered for very, very serious conditions like prostate cancer, and that it would be absolutely crazy for someone to take it for a measly cosmetic condition like hair loss.
What are your thoughts about finasteride, dutasteride? Do you see people coming into your clinic who are having sexual dysfunction or other types of issues because of their hair or attempt to maintain or grow their hair issues? And equally important is that we talk about so-called post-finasteride syndrome. I got a lot of questions about post-finasteride syndrome because I'll describe it in a couple of minutes. It sounds pretty devastating for these people's lives. And I'll explain why it's so devastating for them in a moment. But yeah, what about finasteride, dutasteride, and these drugs that are effectively DHT blockers? DHT levels, if they get too high, indeed can miniaturize the hair follicle, cause people to lose their hair, typically up front or in the back, so-called crown or whatever, widow's peak, or everywhere in some cases. It also induces hair growth on the back, beard growth as we understand. But then people go in and take these drugs to try and maintain or grow their hair, and oftentimes they have erectile dysfunction or other issues. Is that surprising to you?
So here he finally brings up post-finasteride syndrome, and he thinks that it's important to talk about because he's heard many people complain about it. I don't know where he's hearing these anecdotal stories, but complaints about post-finasteride syndrome are really not very common anymore outside of the select few finasteride-hating bubbles that still exist on the internet. Even on mainstream hair loss forums and subreddits like Tressless, discussions about post-finasteride syndrome are not really all that common anymore, and it's because the narrative has changed in the past decade as more and more evidence has revealed it to not be a real condition. Anti-finasteride organizations like the PFS Network and PFS Foundation, they're not even a fraction as powerful and influential as they used to be, and that's because people used to take this condition more seriously. But as people like myself and others have critically examined the existing research over the years, we've come to the conclusion that the condition should not be taken seriously. That's what you should have done too, Dr. Huberman, but instead, for some reason you think we need to address this as if it's a real phenomenon. I can point to you examples of people claiming that the COVID vaccine made them magnetic, or that drinking apple cider opened up an interdimensional gateway to hell where they were tormented by demonic entities that prevented them from sleeping for an entire month. There is good reason why anecdotal evidence and case reports rank towards the bottom in the hierarchy of scientific evidence, as I'm sure you already know, Dr. Huberman. I mean, after all, you are a scientist. There is nothing wrong, of course, with wanting to have a discussion about fringe conspiracy theories like post-finasteride syndrome, but if you want to present it in a serious context, I would have hoped you could do better than just saying some people have asked you questions about it. Who cares?
I think the men that we see these side effects tend to be, younger men in their 20s, 30s, and 40s. And they take it, as you're pointing out, for hair loss. So before it was FDA approved for that indication, at least finasteride was, they did randomized controlled trials to look. And one of the other things that we'll talk about too is just reproductive effects. So they did, lots of studies to see if there were changes in semen quality, for men on finasteride versus the placebo. And there were some very subtle changes.
So we see Dr. Eisenberg showing more skepticism towards finasteride's adverse effects than Dr. Huberman here. So Dr. Eisenberg is probably not as anti-finasteride as Dr. Huberman was hoping he would be. Maybe next time he should try inviting Dr. Trash onto a show. Also, notice a very important but very subtle distinction here in the rhetoric between these two doctors. Dr. Huberman wants Dr. Eisenberg to talk about post-finasteride syndrome, but instead, Dr. Eisenberg is just talking about the regular acute side effects from finasteride. At no point in this interview does Dr. Eisenberg humor any of Dr. Huberman's claims about finasteride side effects being common or that post-finasteride syndrome has proven to be real. The one time he even uses the term post-finasteride syndrome was after Dr. Huberman used it in a question, and even then he still expresses skepticism about it, saying that the mechanism of post-finasteride side effects is uncertain. So here Dr. Huberman is talking about post-finasteride syndrome, while Dr. Eisenberg is just talking about finasteride side effects. It's actually brilliant what Dr. Eisenberg is doing here. He's completely ignoring Dr. Huberman's questions, and Dr. Huberman doesn't even realize he's been baited and switched. I'll really need to learn Dr. Eisenberg's secret the next time one of my friends won't shut up about some shitty anime like Naruto, One Piece, or Neon Genesis Evangelion. Yuck. As far as what he's saying about finasteride's actual side effects, he mentions very subtle changes in semen quality. Finasteride can sometimes lower seminal volume in some individuals due to its influence over the prostate, but this effect is transient and minor, like Dr. Eisenberg says. Also, despite the reduction in semen volume, there is no negative effect on fertility or dangers to the fetus, and I did a video about that recently, which I'll link below. The only thing you do want to be mindful of when you're taking finasteride is making sure pregnant women do not touch the actual finasteride tablets, but for men, there are no issues since finasteride is not birth control and it doesn't cause birth defects when it's taken by men.
But, sort of in post-marketing now, we see these patients in clinic. Everybody to enroll in these studies had normal function. So I think that's sort of important to understand. And obviously that's not life, right? That people come in with sort of different baselines and different amounts of reserve. And so we now know that there's probably people that are a lot more sensitive to these medications than others. And so there are some men that drop their sperm counts dramatically.
That's not true. At least not in the context Dr. Eisenberg is saying it is. He is contradicting what he just said a moment ago about the effects on semen quality being very subtle. Maybe he's just trying to throw Dr. Huberman a bone here, I don't know. The research though on finasteride and fertility, what it shows is that finasteride does not affect fertility in healthy men. I presented this data in my recent video on finasteride and fertility. The effects on sperm counts and sperm function are minimal. However, when men are borderline infertile to begin with, then in that case, finasteride finasteride can possibly make things slightly worse, but men who do not have pre-existing fertility issues from finasteride can take it without any worry. If you are one of the rare individuals who gets fertility issues while using finasteride, you can safely stop the drug for 3 months while your fertility recovers. You may lose some hair ground in that time frame, but it won't be so much that you won't be able to get your hair back when you resume treatment. So finasteride and fertility is not a major issue of concern, and I don't know what data Dr. Eisenberg is basing this statement on that sperm counts can drop dramatically in some people, but that statement is absolutely not qualified or confirmed by any published scientific evidence. I assume it is probably just anecdotal data, and frankly, I'm not sure if even Dr. Eisenberg believes it's true. I mean, like I said, I think maybe he was just throwing a bone to Dr. Huberman here because he didn't want to feel bad contradicting him in front of his own audience.
And usually if we stop these medications, their sperm counts can recover. Usually a spermatogenic cycle is probably about 2 to 3 months. So usually in maybe 3 to 6 months, we usually see recovery for most men. But similarly for, sexual function, I certainly, have a number of patients, that do complain of low libido, erectile function, this post-finasteride syndrome. And the mechanisms I think are less certain because, measuring testosterone levels, which we do, sometimes if androgens are low, or even if androgens seem to be in the maybe normal range or low normal range, we'll try and increase testosterone through a variety of means. Testosterone, clomiphene sometimes we'll give. It helps some men, but not all. So I think the exact mechanism of what is going on here, what is changing, I think, we need more understanding about the exact sort of pathophysiology, neurochemically.
So this is the one single time that Dr. Eisenberg even mentions post-finasteride syndrome by name, but then he goes on to mention causes of low libido that don't have anything to do with finasteride, like low testosterone levels. He talks about treating his patients with clomiphene, and clomiphene, it is a drug that is used to restart natural testosterone production as a means of raising testosterone levels. So he's talking about treating a condition that isn't caused by finasteride because finasteride doesn't lower testosterone. In fact, it raises it. In fact, in studies of people complaining about post-finasteride syndrome, they don't even have abnormal hormone levels. So Dr. Eisenberg is talking about people who have sexual dysfunction for other reasons, like low testosterone, and that's why he says we need to understand the exact physiology when people present with sexual dysfunction. His point is that just because someone presents with sexual dysfunction, they should be evaluated for common causes of sexual dysfunction. Dr. Eisenberg during this video never provides any evidence to support that finasteride itself can cause persistent sexual dysfunction, and that's because there is no good evidence that it can.
It seems like a pretty serious trade-off to either maintain or grow hair or lose sexual function. I mean, I talked about DHT and some of these side effects of finasteride, dutasteride on previous episodes, and I'm not a clinician, but my encouragement is always for people to approach these drugs with a real level of seriousness, if not caution. The post-finasteride syndrome was described in these online questions as seemingly permanent, even though people had ceased to take finasteride or dutasteride. So in other words, they were taking this stuff. I don't know how they felt while they were on it, but they stopped taking it, and the sexual dysfunction issues don't seem to be resolving. Does that mean they should go see you or another male urologist, reproductive health specialist?
So Dr. Huberman repeats this false dichotomy by again presenting this fictitious dilemma that people have to choose between their hair and their sexual health. He's saying we should approach these drugs with a huge degree of caution. The way he's describing finasteride, you'd think he was talking about something really dangerous like immunosuppressants or chemotherapy drugs. There is no evidence that suggests that people need to be any more cautious about beginning finasteride than they would about starting any other drug on the market. If you really examine the data, even aspirin has a greater side effect risk profile than finasteride does. Dr. Huberman is not basing any of these warnings on scientific evidence. He, by his own admission, is basing this just on questions he's heard online. Just because there are groups of irrelevant basement-dwelling trolls from dubious realms of the internet who are claiming that they got permanent side effects from finasteride doesn't make it true. If all Dr. Huberman is going to do here is look up claims about finasteride online, then why is this insight even necessary? Anybody can do that for themselves. What we should expect from a scientist like Dr. Huberman is an actual analysis of the data. If he believes post-finasteride syndrome is real, that's fine, but he should present evidence rather than just passing along whatever bullshit claim he found on some clown internet forum. You're a scientist, Dr. Huberman. You can do better than just regurgitating anecdotes.
Yeah, I mean, oftentimes they do for, these complaints. They start to notice it when they're on the medication, then when they, usually through online research, kind of learn about this potential entity.
This is amusing to watch because it is so obvious that Dr. Eisenberg is playing Dr. Huberman. It's clear Dr. Eisenberg is attributing these persistent side effects to social contagion. This is backed up strongly by the fact that internet searches for post-finasteride syndrome skyrocketed after Merck, who were the manufacturers of finasteride, added persistent side effects to the label of Alopecia in an effort to reduce litigation. Merck's decision had nothing to do with any scientific evidence, of course, but since people were complaining about persistent sides, they went ahead and preemptively added it to the label anyways, since lawsuits are going to be expensive to fight whether they are frivolous or not. And I made several videos about that, and I'll go ahead and link a couple of them below. This move, though, it completely backfired, and this caused more and more people to imagine they had persistent side effects, even if they just took one finasteride pill 2 years ago. So clearly, Dr. Eisenberg is implying that persistent side effects are not due to any underlying physiological cause from finasteride use. He's saying that people who get erectile dysfunction from any cause are likely to blame it on finasteride if they ever took finasteride in the past due to the online narrative that finasteride causes permanent side effects, which of course it doesn't.
Sometimes they discontinue. Now, some men do have resolution when they stop, but there is this permanence in some handful of men. They've done, MRI imaging to try and understand sort of, more anatomically or functionally what exactly is going on. And I think there's still a lot of unknowns about it, but it can be, permanent for some. So they come in, and they see me in clinic, erectile dysfunction, low libido, and then we go down all the host of treatments that we talked about and the evaluations that we talked about. Again, we have resolution in some, but there are some that seem treatment refractory.
So Dr. Eisenberg is saying that he sees some patients who seem to have persistent sexual dysfunction, but he also says we don't know exactly what's going on here because he examines the patients often and doesn't find anything physically wrong with them. I don't doubt Dr. Eisenberg's testimony here, but there are important things we need to contextualize before we just lazily jump to the conclusion that finasteride ruined all these people's lives. The first thing to realize is that erectile dysfunction is a very common condition amongst all age groups. Yes, even in young men. Most of the studies on erectile dysfunction have focused on men over 40, but even in men under 40, the incidence has been estimated to be as high as 30%. The important difference, though, between erectile dysfunction in older men compared to younger men is that in younger men, the cause is usually psychological and not due to any physical conditions, as is often the case with older men. This may be why Dr. Eisenberg examines his patients and doesn't notice anything physically wrong with them, yet they still report erectile dysfunction anyways. These psychological causes of erectile dysfunction may be even more common in people who have searched for PFS propaganda on the internet and are convinced that finasteride caused their erectile dysfunction. The other important thing to remember here is that erectile dysfunction is very often a chronic condition, though it is fortunately also a very easy condition to treat. You ever heard of Viagra or Cialis? Both are very effective drugs for treating erectile dysfunction. So while Dr. Huberman is trying to frame this as a huge health crisis and big pharma conspiracy theory, the reality here is we're just talking about a common and easily treatable medical condition that has many causes and much better explanations than being a permanent side effect of finasteride.
Yikes. That's my only response.
Did you listen to what Dr. Eisenberg even said? He wasn't affirming any of your implications about finasteride. He basically said that people with erectile dysfunction likely are having it from other causes, and that upon examining his patients, he didn't detect any physical or endocrinological causes. Instead, he implies that these cases are likely just psychological due to the influence of social media contagion. Just think about this, for example. Who knew what gluten was 15 years ago? Pretty much nobody did other than gastroenterologists who treat celiac disease. But then suddenly in the early 2010s, this shitty book from this asshole came out, and then all of a sudden, every butter coffee and bone broth slurping mommy blogger Karen idiot from Whole Foods, they magically developed a self-diagnosed gluten sensitivity, and the world hasn't been the same since. Social media contagion is a very real and highly documented phenomenon, and that is why interest in post-finasteride syndrome exploded after Merck's blunder to foolishly agree to add persistent side effects to their drug's label in hopes that it would appease the rabid finasteride hating community online. Spoiler alert, it didn't work.
I mean, permanent effects on sexual health as a consequence of an attempt to maintain one's hair. I mean, this is where, in all seriousness, it just sounds like something that people need to think very seriously about, because as I understand, there's nothing that can predict whether or not someone will have post-finasteride syndrome. Right.
So maybe the stuff would be scary if what Dr. Huberman was saying was true, but fortunately, it isn't true. And I think Dr. Eisenberg is just agreeing with him here out of politeness. Dr. Eisenberg, he never really affirms anything Dr. Huberman says about post-finasteride syndrome. The truth is that there is no real point made in this segment by either doctor, but it's clear that Dr. Huberman thinks that anyone who takes finasteride for, as he would say, just an attempt to maintain one's hair is an idiot, and he gives off really sneery and arrogant vibes here. He makes it sound like people who are taking finasteride are fools and that they should listen to his bullshit hair loss advice instead, which I should remind you, chooms, includes such helpful tips like not wearing hats and putting coffee on your scalp instead of minoxidil. Once again, my video responding to his hair loss advice is linked below if you want to see what an absolute clusterfuck that was.
And I did a bit of reading on this within the scientific journals as well. There isn't a lot of information, as you point out, because it's a fairly recent phenomenon. That highlights a different issue. This may be the first time in history where young males are taking finasteride and dutasteride, and that might be the cause of the post-finasteride syndrome.
What is bullshit, Alex? We have plenty of studies dating back to the 1990s where finasteride was used in young men, like this study here, which included subjects as young as 18 years old. Also, in the hair loss studies on young people, the incidence of side effects was actually lower than in the prostate studies of finasteride in older people, contrary to what Dr. Huberman's statements implied. So, this whole narrative that the drug was never used in young people, and that's why all of a sudden there's this huge sudden uptick in finasteride side effects and post-finasteride syndrome, it's all total broccoli. Don't believe any of it.
Right. I think you alluded to this earlier. Right. These drugs have proven to be very beneficial for older men treating prostate issues.
Exactly.
Right?
Yeah.
Right. So this is a post-finasteride syndrome. I think falls under the category of medical conditions that a few years ago we would hear the same about chronic fatigue syndrome, even fibromyalgia. Not long ago was considered one of these, is it all a psychosomatic issue? Now, we now clearly know that's not the case for fibromyalgia, by the way. But I can recall a time not that long ago when people in the medical profession kind of like, well, yeah, I don't know if this is a real thing, but
No, that isn't the case. Neither fibromyalgia or chronic fatigue syndrome are universally accepted by the scientific community. They are hotly debated and highly controversial subjects. And just like with post-finasteride syndrome, there is no scientific consensus that these conditions even exist because there are no physical findings or lab tests that can be used to diagnose them. Although I have to admit it is interesting that Dr. Huberman brings up these conditions, as there are a lot of parallels between post-finasteride syndrome and these other fake conditions. For example, researchers in the UK who were investigating chronic fatigue syndrome as a psychosocial illness were harassed. I can empathize with that completely, as I personally have been harassed by the PFS community, and I know researchers who have conducted studies that show that post-finasteride syndrome is a mere psychological condition, such as Dr. Trueb. They are common targets of hate and ridicule by the small handful of finasteride-hating communities online. So, when you've given up on trying to use scientific evidence to convince people of your condition, and you instead resort to outright bullying and harassment, then you are no longer part of any serious scientific community. You have officially become a cult at that point.
Post-finasteride syndrome sounds certainly real for the people that are suffering from it.
Exactly, yeah.
It sounds real for the people who are suffering from it. Wow, what a great argument there, Dr. Huberman. I'm sure that the stories people tell about alien abductions from techno-necromancers from Proxima Centauri sound very real too, but I don't accept that as good scientific evidence, and neither should you. It was nice, though, of Dr. Eisenberg to politely nod rather than call you out on this embarrassing quip, though, so make sure you send him a fruit basket when this is all done.
Okay, well, the reason I'm spending so much time on this is that I get a lot of questions about it, and there are clearly a lot of young males who take finasteride or dutasteride or are thinking of doing that for cosmetic reasons, and I think they should be aware of the potentially serious consequences.
Yeah, agree.
Yeah.
So once again, Dr. Huberman is concern trolling. He's worried about people with hair loss taking finasteride because for him, finasteride is a drug that should only be used for very serious conditions like prostate cancer. Dr. Eisenberg continues to just nod along politely though, as this is no doubt very awkward for him and he wants to move on to the next topic as soon as possible. It is kind of like when you're at a party where everybody is just trying to get a buzz on and have a good time, but then someone annoyingly randomly decides to start arguing about politics. You just go ahead and nod your head in that case and smile and hope that someone else changes the topic as soon as possible.
But you did say earlier that if someone has a penis, you can get it hard. Right. So all is not lost even for these post-finasteride syndromes individual. Good. Okay. We'll use that.
So this whole time, Dr. Huberman was talking about finasteride like it was Russian roulette, but now it turns out that a urologist can get anyone with erectile dysfunction a hard penis, so maybe it's not all that serious of a condition after all. Dr. Huberman is even laughing about it. I agree. Dr. Huberman's bullshit is so funny that he can't stop laughing at how bad his take on the whole thing is. So at last, we're finally in agreement here, because it is all true. Erectile dysfunction is one of the easiest conditions in the world to treat. Drugs like Viagra and Cialis have been around for decades now, and any theoretical issues you have with erections can easily be treated with one of these drugs. Furthermore, these drugs are known to have additional benefits beyond just treating erectile dysfunction, including being good for the prostate and even increasing testosterone. So, if you get erectile dysfunction and you end up treating it with one of these drugs, you may actually be better off overall. So, this whole segment on finasteride by Dr. Huberman, it was completely fucking pointless, and even he realizes it, which is why he's now laughing at the past 7 minutes, which he wasted by fear-mongering about a condition that, even if it did exist, would be easily treatable. So, cool story, bro. So now he moves on to another subject, and thank Christ for that. But I am still a bit pissed off here at Dr. Huberman because I was supposed to make another video yesterday. I spent hours gathering all this important research and taking notes on a particular beauty supplement, and I was super excited to start filming it. But then right before I did, this steaming broccoli of a video got dumped on my desk. So unfortunately, I had to put it on hold in order to call it your bullshit yet again, Dr. Huberman. But whatever. It's really unfortunate, though, that the hair loss videos that get the most attention on YouTube are videos like this. But that confirms what I've been saying for a long time now about contrarian opinions getting more attention than mainstream opinions. To summarize what's happening here, I think Dr. Huberman's sudden interest in hair loss is mostly related to his desire to make money. Hair loss is a huge industry with a lot of scams, but many of those scams are very profitable, especially since supplements don't need FDA approval in order to hit the market. Dr. Huberman is a supplement salesman who makes a tremendous large amount of money selling supplements of questionable efficacy on his personal website, and being how common a problem hair loss is, he probably sees a potential for profit. He knows whatever supplement he intends to eventually sell will be much more profitable if he can convince his viewers that legitimate treatments like finasteride are too dangerous to even consider. And Dr. Huberman has over 4 million subscribers. He's so popular, he's even managed to get Mark Zuckerberg to appear on his channel in person for a face-to-face interview. So no doubt Dr. Huberman, he sees the profit potential in convincing people that whatever bullshit he tends to sell is a better alternative to things that actually work, like finasteride and minoxidil. He already has a bunch of questionable pseudo-nootropic cognitive enhancing supplements on his website that are sold in these fancy minimalistic packaging that could easily be mistaken as pharmaceuticals, so he could probably venture into the hair loss snake oil supplement business if he wants to. I know this because other actual snake oil salesmen in the hair loss industry like HairGuard have even used Andrew Huberman's own content as propaganda for their own scam products. Of course, Dr. Huberman could prove me wrong right now by pledging to never sell or sponsor a hair loss product ever in his career, but fat chance of that ever happening. So, if you guys remember the ending to my last video on Dr. Huberman, what I told him is that while I disagreed with his conclusions, I still think he's a smart enough guy that I'd like him to re-examine the subject of hair loss, but with a greater degree of reverence towards the existing data. Well, I've officially changed my mind on that now. I don't want him to talk about hair loss anymore. It is very clear to me that Dr. Huberman, while he is obviously a very smart guy who is an expert in his field, is way too biased and agenda-driven to talk about hair loss in an objective manner. Maybe if he really wants to talk about hair loss, he should have an actual dermatologist on his broadcast instead of talking about hair loss with a urologist. But hair loss, it is a devastating condition for men, and there's no room for any of the conspiracy theories or speculative nonsense that Dr. Huberman is pushing. I think in theory, Dr. Huberman is capable of giving a good take on this subject. Unfortunately though, many people, and it's not just me, they have noticed that more and more often, Dr. Huberman is officially stepping outside of his field of expertise. When he does that, the quality of his medical advice goes downhill very, very quickly. But speaking truthfully, I don't think he really cares if his information on this subject is accurate or not, because I don't think he actually cares about this subject one way or the other. Ultimately, Dr. Huberman chooses his subjects based on how they can benefit his channel or possibly his bank account through future supplement sales. So, last time, Dr. Huberman, I asked you to try again, but this time, I'm asking you to quit. God bless.